community since 1978. So for more than 4 decades, Scranton Primary has helped keep our community healthy with preventative medicine, with public health. It is just imperative that we have institutions like Scranton Primary. And Joe Hollander has been at the helm of Scranton Primary for over 7 years, and we're so honored that he has been there. Scranton Primary has done so well getting vaccines in arms in this last couple of months. We're indebted to Joe, and I'll kick it over to him. And thank you all for coming again, Governor. We're so happy to see you in Scranton.
Thank you, Mayor. Morning, Governor. Morning, Representative Kozarowski, Representative Flynn, and Mayor Cognetti, and various media services. Welcome to Scranton Primary Health Care Center. Governor Wolf, we're thrilled and honored you chose to come to Scranton Primary Health Care to see firsthand the work our staff is doing to protect the citizens of our great Commonwealth. Our dedicated employees have been working hard for the last 12+ months since the pandemic first hit our area. As a federally qualified health center, we understood we had a responsibility to the community to ensure that they had a place to obtain primary medical care as the local emergency departments became overcrowded. Early on, through a combination of telehealth visits and in-person visits when appropriate, we remained open from the very early days of the pandemic. We pivoted again and began offering COVID-19 testing, initially using national labs. We then invested hundreds of thousands of dollars in rapid test equipment when the wait times from the national labs became extremely long. We were thrilled when the Department of Health called us in late December to say our vaccination application as a vaccine site was approved. We were honored when they asked if we would accept the responsibility of vaccinating not only our own employees, but also healthcare personnel from other practices in the area, as well as first responders. We continue to work diligently to find a balance between vaccinating our own patients as well as those in the community who want to be vaccinated. For example, yesterday afternoon we were at a senior citizen low-income high-rise apartment building just a few blocks from here vaccinating eligible residents in their community room. We take our community responsibility very, very seriously. Last week, we agreed to vaccinate all new patient admissions to the Gino Murley Veterans Center, since there was no process in place to provide for those veterans. We are proud to be able to offer vaccinations and testing during the pandemic while still providing our normal services such as pediatrics, family and internal medicine, infectious disease care, women's health, prenatal and postpartum care, general dentistry, as well as assisting people in the community in navigating the health insurance marketplace. We're very proud of the fact that we've been providing care in the area for 43 years to anyone needing it, regardless of their ability to pay. I'd also like to take a moment to thank Drew Popish from Representative Kozarowski's office, Sarah Goulet from the Governor's office, Pennsylvania State Police, and Commonwealth Media Services, who were instrumental in working out the logistics for this visit. It is now my pleasure to introduce a friend and a supporter of our health center, State Representative Marty Flynn.
Thank you, Joe. Joe Hollander has been the backbone and nurturer Scranton Primary Health Care Center started as the desire of 2 founders to help 4 indigent women. It took them nearly 4 years to get this miracle off. They persisted and never gave up. In the writings online, they speak about the struggles and the roadblocks that they encountered before they experienced their first miracle in helping to establish this wonderful community asset. Over the last 42+ years, the miracles have continued at Scranton Primary Health Care Center, having grown to provide services internal medicine, pediatrics, gynecology, a prenatal clinic, and social services, including an outreach to the area's homeless population, along with the dental clinic. The mission of this team is that they will provide quality primary medical and dental care at a reasonable costs to all persons in our community, including those who are underinsured and uninsured. While I'm sure that some struggles continue, we are grateful to Joe and his team for the wonderful work that you all continue to do. We are incredibly fortunate to have this center here to help the most vulnerable members of our community every day with their health care needs. And now, with the support of our governor, providing our entire community with these vaccine shots in a safe, organized manner that we can all be proud of. Governor Wolf and his team have been ramping up the safe distribution of these critically important vaccines as they become available. So we urge you to continue to follow the guidelines promoted by our governor that will help keep you safe. We now have a very dedicated, elite COVID-19 task force that was tasked with organizing and ramping up this accelerated and focused distribution plan. And they are already moving at warp speed. I'm very proud to say that a dear friend and colleague of mine is responsible for much of that success. So would you please welcome Representative Bridget Kozarowski. Thank you.
Good morning. Thank you for coming today. I would like to thank Scranton Primary Health Care Center CEO Joe Hollander and all their incredible staff for not only hosting us today, but for their commitment to serving our community and their dedication to combating this pandemic. Thank you to Governor Wolf for coming to Lackawanna County and witnessing the great things our providers are doing here today. I'd also like to thank my colleagues, Representative Flynn, Lackawanna County Commissioners Dominic and Notariani here with us today, Scranton Mayor Paige Cognetti for attending today. You know, I stand here today, and behind me is the high school that Representative Flynn and I graduated from, Scranton Prep. And, you know, the Jesuit teaching taught us throughout our years that living your life with and for others is something we learned. And today, in this building behind me here, Scranton Primary, they certainly exemplify that true teaching. Here in Lackawanna County, we are working together to prioritize the health and safety of our residents. And I am grateful for all your collaborations. I also wanted to thank all the wonderful, willing providers we have here in Lackawanna County. Your work is saving lives, and I commend each of you. As I look out here today, I see Jason Kavulich. Jason truly does define collaboration. Jason Kavulich is the director of the Lackawanna County Area on Aging. He, along with our providers, have tirelessly worked to vaccinate those here in Lackawanna County and have helped our seniors move forward with vaccination. A little over a month ago, I was appointed to serve on the COVID-19 Legislative Task Force, and I admit it was a very daunting task. At the end of the day, we were faced with the task of coming up with a plan to allocate a vaccine supply that simply did not meet the demand. We have a state that has the infrastructure, we have incredibly talented providers, and the selfless volunteers to get this vaccine into the arms of Pennsylvanians. But all of that is limited if there is no physical vaccine to allocate. Last month, we as a task force took the initiative to limit the impact of first doses to secure doses that would coincide with the Operation Warp Speed calendar. We were able to successfully secure those doses and meet the CDC guidelines in doing so. With the FDA approval of the Johnson & Johnson vaccine, we were able to create a special initiative to prioritize the health and safety of both our teachers and our students while paving a path for our children to get back into the classroom safely. With the increased amount of J&J coming into our state, we came up with another special initiative that was a step in the right direction, not only to protect our most vulnerable population, but also help speed up our vaccine rollout and vaccinate our essential workers. Through the regional vaccination clinics, we will achieve greater access for seniors who have been struggling to find available doses and more equitable distribution by allowing communities to direct doses to their most vulnerable residents. There has absolutely been some hiccups along the way as well. When you are dealing with a brand new vaccine and a novel pandemic that has paralyzed our nation, not everything will go ideally. As a registered nurse for over 25 years, I come from a background of if you see a problem, we must find solutions to fix it. So I am committed to serving alongside our governor, Acting Secretary Beam, PEMA Director Padfield, and my Senate and House colleagues that make up our joint task force in prioritizing the health and safety of our residents across our Commonwealth. Thank you for joining us here today, and it is my honor to introduce our Governor, Tom Wolf.
So thank you, Bridget. I just want to thank everybody for being here too. Mayor Cognetti, thank you, and thank you very much for being here. And of course, Joe, thank you for hosting this. County Commissioners, thank you very much for being here. And I work closely with obviously Representative Kozarowski, who, as she said, is also on the bipartisan vaccine task force. And is doing a tremendous job. And of course, Marty Flynn, Representative Marty Flynn is here too. And I always appreciated the great work he does in Harrisburg. I got to say that this area, this region is very well represented in Harrisburg by these folks in so many different ways. So again, thank you for having me here. And I really want to just give an update on how we're doing with our vaccine rollout. We're doing a great job. As Representative Kozarowski said, you know, the chief problem is that we still don't have enough supply, but each week that keeps growing. And each week we can do a little more to get this out. And as a result, we have a lot of Pennsylvanians who have been fully vaccinated, and we're really making progress. According to a number of observers, as of today, we're 15th in the nation in terms of getting shots into arms, first doses. We're above the national average, well above the national average in terms of first doses, and we're above the national average on second doses as well. And I think we're in the top 3 when it comes to the largest states in the country. So, as Representative Kozarowski said, you know, we are making real progress. Together, the task force has worked hard to identify challenges and break down the barriers that exist to getting vaccines into arms in Pennsylvania. And the day-to-day work, of course, is done by mainly by folks, the hardworking folks who are right here at the Scranton Primary Health Center. As you know, the center is a federally qualified health center. It's one of the many that are doing incredible work all across Pennsylvania, and they're serving our most vulnerable populations. But as the only federally qualified health care center in Lackawanna County, they've had an especially big role in making sure that vulnerable populations in northeastern Pennsylvania get the vaccines as quickly as they possibly can. And the dedicated staff members who work here have gone above and beyond throughout this pandemic. As Joe told me, they never really closed down. They never closed down. They were here through thick and thin, through the tough times of the shutdown, working on the front lines to make sure that the people were getting tested, were being cared for, and now getting the vaccines. It's really an honor, and it was my honor to take the tour this morning and see this dedicated team. Scranton Primary Health Center has taken an innovative and, as it turns out, very effective approach to vaccine distribution. Phase 1A of our vaccine distribution plan includes some of our most vulnerable populations, and the same factors that make these Pennsylvanians more vulnerable to COVID-19 also often make it more difficult for them to access this vaccine. And so the team here at Scranton Primary Health Center is committed to helping all these vulnerable populations And that includes making sure that vaccine is accessible. To meet that goal, they've worked with great flexibility throughout this vaccine rollout. They've established an appointment system for patients who want to be vaccinated. They also, and we talked about this today, they also offer eligible patients who come in for some other reason the ability to get a vaccine while they're here for that other reason. And that effectively reduces the number of times a patient has to actually make this tough struggle to find transportation, find a way to get to a place where they can get the vaccine. The team here is also in close communication with their patients, but they've also reached out to people who are not patients, non-patients here, who are eligible. They've set a process to take the vaccine to people who really need to be vaccinated but can't come here. So they visit senior living high-rises. They offer vaccines there. All of these things are incredibly effective, and they're really making this vaccine available to people who otherwise would not be able to get them. This is an incredibly effective way to reach populations of older adults who are eligible, going out to them. And this is a great example of how providers are reaching out to their communities to help break down barriers that we all have to access to this vaccine. They're working affirmatively and they're working effectively to vaccinate eligible individuals wherever they are. So I want to thank everybody who works here at the Scranton Primary Health Center for your hard work, for providing an example that other providers can follow. Now, all of us are happy to take questions. Any questions? Yes.
Governor, summer camps in our area have been asking when there will be some updated guidance. They've been asking for it to be before April 1st. Do you expect that to happen?
Yeah. In fact, we had a meeting on that yesterday. So we should hope to come out. I think the goal was to have some guidance by tomorrow.
We're hearing of people traveling across the state or even to other states to go get the vaccine. Are you doing anything to make sure that people do stay local when getting the shot?
Yeah, we don't have anybody on the border saying you can't go over here. I think the thing we can really do is make sure that we're doing a better job than any other states so that people don't feel the need to go anywhere else. And that's why I think it's important to say, we're 15th in the country right now. I'm not sure where we are in terms of all the states around us. There might be some that are doing a little better than us, but that changes on a daily basis. For the most part, we're doing as well or better than anybody in our neighborhood. So there really shouldn't be much of an incentive to go anywhere else. Just want to stay here. Yeah.
Will everyone in the Phase 1A be able to get their appointment set up by March 31st as you had set a goal for?
That's what we're still planning on, yeah. And when we say either get that first shot, I mean, if they go through the whole thing, or first shot, if it's an appointment, it's not one to say, okay, it's 3 months out. It has to be within a reasonable period of time, a couple of weeks. That's the goal, and I think we're going to meet that. The other goal we set for ourselves was on educators, teachers, administrators, bus drivers, cafeteria workers, janitors. The idea was that we would start with the early childhood providers, caretakers, and then pre-K, and move up to like 6th grade by the end of the month, and by the middle of April have every educator up through senior high school. It looks now like we will have every educator all the way through done 2 weeks early by the end of a week from yesterday, actually, next week. So we're making great progress there too.
Governor, at 67.9%, Pennsylvania ranks 35th in the country for getting at least one dose to the 65 and older population.
I think that's out of date. You ought to look at the CDC as of today. It's actually
my apologies. That was as of this morning. And across the state, the rate seems to vary widely. Lackawanna County appears to be doing well in this corner of the state, but more rural areas like Susquehanna seem to lag according to available data. How can we as a state better reach that population, and how can we ensure more equity in rural areas?
That's a great question. The idea is, I mean, the chief constraint is that there just isn't enough vaccine. So what we're doing, and have done since the beginning, is saying, okay, we have almost 13 million Pennsylvanians. And eventually we're all going to have the vaccine. Some of those, Moderna and Pfizer, 2 doses. How do we get that out as quickly as possible? if we had our druthers, I'd snap my finger and everybody would have a vaccine, their second vaccine, immediately. We can't do that. So we're rolling this out as quickly as we can and as we see it as efficiently as we can. And I think the numbers in terms of where Pennsylvania stands nationally suggest that we're doing a pretty good job. The goal is to make sure we do this fairly, that no county, no group of people is left behind, and that we get this done with all great speed. We're doing, I think, a pretty good job at that. But we won't be doing a perfect job until everybody's vaccinated, until we have enough vaccines to meet the demand.
Governor, just going off of that, I mean, there has been criticism for vaccine rollout when it comes to seniors. Is that unfair? Is it fair? What do you think?
If I'm one of those seniors who hasn't been vaccinated, it's absolutely fair. The question is, given the constraints we operate under, the supply that's not up to demand, the fact that we have logistical challenges, the fact that we have to find good places like this to make sure that we're getting shots into arms all across the state, could we have done a better job? I don't think so. I think we're doing the best we possibly can, and that's why at the task force meetings that we meet at least twice a week, and it's a bipartisan group, that we're actually looking at this to say, where can we do better? But I think, given the fact that we're, doing pretty well nationally, that I think we can take comfort from the fact that while we're not perfect, while we're still not at the place where every senior, everybody who needs a vaccine, which is all of us, has gotten that. Until we get to that point, I think we need to keep working as hard as we are to figure out the best way to do this. And I think we're doing pretty well. We're not there. Until we get the supply up there, we're not there yet. Okay. I'm sorry. One question? Yeah.
Do you just have any idea of a timeline of when we might move into the next phase?
I'm sorry.
Do you have any idea as to when we might get a timeline to when we might move into the next phase?
You mean in terms of the vaccines?
Yeah.
Well, we actually have already moved into the. Are you talking about 1B? Yeah, I don't know. I mean, we have sort of changed a little bit in terms of when the Johnson & Johnson vaccine came online. It was new vaccine, and the Moderna and Pfizer continued to increase their doses. So everybody who was in the traditional 1A kept getting more and more vaccines, and we kept moving faster to get that group. And what Johnson & Johnson gave us the chance to actually say, okay, the president is now saying educators ought to be prioritized. We did that. And I think we have some first responders, police, fire, food workers, grocery store workers, food processing workers, agriculture workers, the folks who really are on the front lines and actually we depend on throughout this. Again, with the Johnson & Johnson, we have the chance to make sure that we get to that group. My real hope is that we actually get to, the president has now said, May 1st, that everybody should be eligible, which sort of throws out the old 1A, 1B, 1C thing, and I think he's right. The goal should be to get to that point as quickly as possible so that it's open to everybody. That's the next, in a perfect world, that'll be the next phase. Okay, thank you very much, everybody.